Paftai. E whamana ho ni tai au. O te longono le o ni tai au le te lento nau mai tau te whielo al tūlanga. Ele o iese tūlanga whapea ua whaititi al tātou whama. O te mine ne ua mautinoa o loo haawau pea o na pipesi tātou whamai. Le ngatai upolu nei ia whapea whai o nā lia e ia nisi o vaenga o savai. O e te mi atola ni tau mai ne aso tōna i anaf o ilas tōna. Ia ua lua fe se lau iwa sufa ia mi se la tu fatase le tu atoa. Se lau fast food fa se le mai le fiafia la sovrai le tau mai le fiafia la tōna. Mai aile i o le fiafia la tōna i sa wha maui nei luas fulu lima ia maliu. Ni maliu e tele al whanau raiti. I tonu alwa ai ia o le tele o ngase mi sela. O le ape o le loto i whalea le o le Apia Urban Area. A mata mai ai i whaleata i sifo, whapefo ia mai maunga sifo. O whapamunga na iai le whaangasoronga o tātou tuipui. Ia maneanga i runga o lea o whaangasolo a ia lea runga o tuipui. He alu al whaamurumua i tausanga ia o mātou lo tausanga i pito i awhia. Tātou sirisira fo i tele o maliu iai. Il tele la whanau laiti la no me tō tausanga. Se ase iai se si lunga le luas ful tausanga. Vanga na aile talavou le tosu fit tausanga le se mai hil tūranga pēr mali wai. O le taimi ho nei to tonu i luas fulu ia whanau laiti. O le tono le ICU. No ave iai ho ele whaistinga ina tele. Le last 24 hours we to fulu fo i wate el fale. Ia sa tau fia i whai mai. Alo ai lau tele ia i mai nea whai o tangata talu o na tau fia i ono se lau fitus fulu maleiva. About 60 to 90, 69 to 70% have been discharged home in status quo. O ne vai fo ila kele o keisi o mai dunga le APCC, kako General Outpatient. In the last 24 hours, le Saturday yako, 122 measles cases were seen. Yeah, malina numera, to fitus futas into your fale, sa tong fitium to your fale. Yeah, o se vai ngalan na le fanga so longo o kako immunization ne walu pensilafia le mass vaccination campaign. E luas fulu varu teams e anga i tonu Apia Urban Area. A mata mai i loto anu, alu anga i toa mua, alu le anga i tonu le anga i tonu le motu, nei. E le wha mai a le leilo pasene, e na wha solo lo le e lista al wha tai whaingta le a laua a mata, e ratu i whale ula, malie, a whenga, le au waa. Malwatu ai al fa solonga na sale mo. Ola te fo ne no wai tu ala fa wa ave fo e team stai to do. Nga lui fa tasi ma te mai te so fo lo no tu wai fa yara to outreach program. So so ni fa nga yo ma vai mai la to e li fa yentu pu a mata ai. Ole tu ranga la na ai. Ola fa ma fa mo ia vai nga le. Ono ire tele na mai tele o tangata ua maua. Ia mamari liu i whengata i arato complications o tamaiti. O iere pōlenga o nisi whapere o iere tui. Sa loi mautu lo se pasene lei. Ai Michel whanau raiti. O mwhai o na whai tui. Ia na whanga solo lo leo o tele o le atunu. E o lo mautino ele I whai ani tui o ele pōlenga I te uto e mau el whama. Tūlanga nā rea ngai ia tātou ngaruenga ro whai nei. Ia nea whai nai tai dua aso ma ave ia le updated tātou kapeneta. Ia mai whai whautuanga la tō ai mai I tūlanga e whanga soronga. Olo fully enforced bail tātou proclamation of state of independence for 30 days. So leo te lo leo whanga solo. Ia o tūlanga fo I pei ona iei ia te malanga inga le vā o tutuila m tātou o lo tere whawhitauri. O lo iei nisi o lo o wha mautu mai el mano Amerika Samoa e tasi ale me isi o kwai ia the proof of immunization. Na tono le matanga renga se fo malo loina. Tele la nisi sa whaingita na talia ona e atu e se ele o le matanga renga se fo malo loina le rato il pepa. La lana le avel fautuanga I tato watunu mo ila to e malanga. Ia sosoni mai pe ia o mai pe nei. Ia e mau atu se pepa whamani e o mona whai tui. Ia ele malanga atu. Ia Amerika Samoa o le fautuaina te leo pe o le shipping ma le tatou vālele. Ele lei o le siaki ai le io. Ele le siaki ai le io. Ia ua pe se io lu o le vaalalo ale tene na ie whawhitauri lea sa vese fo il vaso na tene en tafi e tanga te tos fuku montupu. Ia ono le se o le pepa na atu malatou. Ele o le pepa na lae a mai ia le finangalo le malo Amerika Samoa e avatu. Tele o nei mele ni mea tātou te whaia o le tau te comply I regulations pa tuunga na mai Amerika Samoa. Ia wale la to pui inga pe na iai. Ia ona nafi o nil taiao le sa o nafi le sa fa nga sono mai e tira me ave soani. Al taiao nei le wa amatai le nga solonga al faingo tu yo sa vai il motele se la fai. Sa lo se fulu. The fulu fa le luas fulu teams la wa posti sa vai. O la tu fa fo ila I fale mai ve sa pa te lua teams. O whalalo e lua teams, sa tau e lua teams. E whaopopo I teams ala iai. E voi teams o ta vale ngā solo ai tu e whale o komiti ma fo ngā lue whatasi masui o tamaitai masui o le malo e whamaupopo. Mea ngai e tuei au whaitu e whai o la tautui. Sa fotu pe tolu teams lai o iai. Lea whao iai fofuanga o vaipo uri lai ta pena pea. A iai ni mai tinga ina o whaitu a tol na ia inare a ta o toi ma ave iai e le vainga. Tua sivi e wha teams lau tu uai. Ia ma fixaiti I market. So soani ia whaingo fie I tangata o no I whai o la tautui pui. Ia o tūlanga lana re tapenanga ma le tātou tali atu le matu ia ma le ongo le. O le special mise le tono tātou atunu. 24th of November, 2,194 cases of measles have been recorded nationally, including 144 in the previous 24 hours. There have been 25 measles-related deaths, and these are mainly below 3, and the median age is around 13 months. Faleata West and Maimonga West continues to have the highest number of measles-related to date. So we are looking at 183 measles patients currently admitted. This is 142 here at our main reference hospital, 6 at currently at Malietoa Tanufililua in Savai, 18 at Leon Moenga, and 17 at all other district hospitals in total. Admissions, we still have 20 critically ill children in ICU, HDU. We also have 4 pregnant women at TTMO currently being treated. Out of all these, 30 have been discharged home in stable condition. Looking at the national level, 2/3 of all admissions were all measles cases related. And there is also noted in the surge of admissions, this is including measles, diabetes, sepsis, and all other poorly controlled hypertensive and all other cases. The total number of measles admissions recorded since the outbreak to date has been around 679, and 69% of that proportion have recovered and have been discharged home. At the last 24 hours, on Saturday, at our APCC clinic, 122 measles cases were seen, of which 58% were able to go home. Now our measles campaign is ongoing, targeting the most problem area of Faleata West, Waimaunga West, especially the priority groups of 6 months to 19 years for everyone, and 6 months to 19 years, males and females, and 20 to 35 years, non-pregnant women. So these are women of childbearing age. This is prioritized as the most vulnerable for complications, severe complications of measles. Yesterday we mobilized 14 teams, about 16 teams. We're hoping to have 20, but we're moving there. We're covering all of Savai in the campaign now. We're dispatching 2 teams each to help with the district hospitals, Satupaitea, Foalalo, Sataua, 3 teams to Safotu, and then 4 to a city with a fixed site at the Salilonga market. As we move along, the nurses in the district are very confident of their coverage, but we have to make sure. So we are still posting a lot of staff there. And as we move along, we are going to continue to reinforce the teams depending on the need. We have finalized the document for proof of immunization between American Samoa and Samoa. There have been a lot of issues because of their public health declaration of emergency and the fact that they just wanted a proof of immunization or evidence of being immunized, and they haven't really stated who will issue that. So there have been issues of others being issued from Savai, others being issued from district hospitals, those who have done immunizations. So they have come back to us to make sure that it's being issued here at the Ministry of Health and it's been signed by 1 or 2 people. That would be the only one they would recognize. So we have advised the shipping agencies and our airlines so that people will know where to get it. So we have a team here at the API unit who will issue those looking at your record. If you need to be immunized, you will be also, and then certified and get that document for you to carry to American Samoa. So I think that's all I can say for now. We still have a big problem at hand, and we are continuing to receive a lot of assistance, especially staff from New Zealand, Australia. We even have a team from French Polynesia who have landed here during the weekend. We are getting supplies also from New Zealand and Australia. And we are seeing reinforcements of staff coming also. We have also communicating with WHO for more EMT teams to come.